This graph is quite interesting in that it allows us to also apply different scenarios and see what our cardiac output and venous return would be like, and also estimate our right atrial pressures and sometimes our mean systemic filling pressures as well. So in green, I'm going to change the scenario to a scenario where we've got increased cardiac function. So when we have increased cardiac function, the curve, rather than change its position on the x-axis, remains at beginning at -2, but the angle changes. So when there's increased cardiac output, the angle becomes more steep, and the new intersection on our vascular function curve can now allow us to figure out our right atrial pressure, which is decreased, which makes sense. As cardiac output increases, there's more blood moving forwards, so our right atrium will decrease in pressure, which will pull more blood into the right atrium. So this also increases the pressure difference between our mean systemic filling pressure and our right atrial pressure, which, if we go back to our equation, means that because we're taking less of our mean systemic filling pressure, our venous return will also increase. And as we know, venous return and cardiac output are linked. So when there's increased venous return, there's increased cardiac output as well, which makes sense as we've increased our cardiac function curve and it's moved up along our vascular function curve, which has that bit of redundancy that was already there, allowing it to accommodate the increased cardiac output. And now we've reached a new equilibrium point, or a new steady state operating point, that's led to an increase in our venous return, an increase in our cardiac output, and a decrease in our right atrial pressures. But our mean systemic filling pressure has remained the same, because remember, our vascular function curve has not changed at all. So now let's flip the scenario and go to a cardiac function curve that's lower. So this is someone who's probably got some heart failure. We still start at -2, but we change our angle so it's less steep. And you can see here that we get a new steady state operating point. And this steady state operating point, you can see if we extrapolate it down, leads to a higher right atrial pressure, which you tend to see in people with heart failure. They tend to have higher right atrial pressures as well. And you can also see that the difference between the mean systemic filling pressure and the right atrial pressure has decreased. So there's a decrease in the differential here. So if we were to plug this into our equation, we can see that we have increased right atrial pressure and we've got a lower venous return, because our steady state operating point is lower along that vascular function curve. And as we know, that's going to lead to a lower cardiac output, which is expected here. And in this type of patient, you may see some blood backed up into the system. Although it's not directly represented here, the vascular function curve above the cardiac function curve is redundancy of the vascular function curve, which is either to do with vascular tone or the blood volume in the vascular system. So in this sort of patient, you might expect that there's excess volume that's sitting there waiting to be used if the heart function would pick up. But in this patient, it's not picking up. So it's likely just going to sit there and distribute out into the interstitial tissues, leading to edema. The vascular function curve doesn't explicitly say that here, but you can extrapolate it based on what we know clinically in these patients.